Now, as we continue our series on health and wellness with our resident social worker, Sister Regina Dunlap, today we'll take a closer look at three different healthcare professionals available to us. We're going to talk about medical doctors, nurse practitioners, and physician's assistant. Now, Sister Regina, can you share some examples where advocating to set an appointment with a medical doctor is just absolutely necessary?
So a lot of times we come into situations where there's an acute need, like an injury or something that's happened suddenly. That is definitely a time where you should ask to speak to a physician because they are the ones who handle those emergent needs.
Yeah, because a lot of times we get the nurse practitioner, but you're saying like when you're feeling like a new type of symptom, we want to see the doctor?
So, like if it's a chronic thing, like high blood pressure or asthma or something like that's something a nurse practitioner or a physician assistant could take care of. But like an injury, something that's causing you tremendous pain, that's something that you really need to see a medical doctor for.
Okay, now you just kind of hit on it. In many cases, a nurse practitioner are our first point of contact when we go. Could you elaborate on the specific areas where we should trust the expertise of the nurse practitioner?
So nurse practitioners have a different kind of training, similar to what doctors have, but they're trained in more interpersonal relationships with patients, and so they are able to like treat things like their high blood pressure, asthma, like I said before, diabetes. Those things are perfect for them to address for you.
Yeah, because I mean, oftentimes, like, we don't really trust in them like we're doing the doctor, but you're saying they have specific training and we can trust in them too.
They're definitely board certified. They all have to go through a certain type of school, and they all have to be certified by the state. So they are well versed in treating those chronic conditions.
Okay, now sometimes we might also encounter physician's assistants during our doctor's visit. Could you shed some light on the kind of medical issues that they can help us with?
So physician assistants, they really do a lot of the same things that providers, that medical doctors do. They do have to practice under a doctor. But the physician assistants, different from the nurse practitioners, they can actually do procedures and things like that, whereas nurse practitioners don't really do those kinds of things. So you can, yeah, like if you needed to have like a procedure and your primary and your doctor said that it's okay for the physician assistant to do it, feel free.
Wow, I never knew that. I just always thought the doctor, but you're saying that, the difference between the nurse practitioner and the physician's assistant is that they can perform procedures.
Mhm. Yes, that's correct.
Wow, this is some awesome information. Now, beyond conventional medicine, there are also alternative healthcare options like naturopathic medicine. What factors should we be considering before exploring a naturopath?
So a lot of times we like get medications that give us side effects or medication or the normal medication routes don't necessarily work for us. So naturopathic physicians can provide so if you have like a condition like inflammation, they can, give you advice on things that you can use that are natural, that may even give you the same effect as a medication or even better.
Yes, and you were talking to me earlier about that. They can also include massages and this kind of thing.
So naturopath or holistic, they have like 12 different specialties just under that heading. So there's massage therapy under there. There's acupuncture, chiropractic care. Those things all fall into the naturopathic positions.
Now, why do you think, because oftentimes I know like when I've gone to the doctor and I've mentioned like a naturopathic medicine, they don't really want you to explore that. Why do you think that is?
I don't know. I think it's probably more like, like they're not trusting of these natural things because their training is in, I find a symptom, I treat that symptom with a medication or procedure, when the naturopath is there about the whole person, the spiritual, the emotional, the body. So they incorporate that in addition to the medicine. So, sometimes I feel like medical providers just don't want to be replaced.
Yes, and I know you were saying, like, don't always reach for the medicine. Like, say if you have a stomach ache, you were saying to try.
Ginger. Yeah, ginger, like there are ginger chews that you can use for nausea. Also like mint, like even just the smell of mint can help with nausea. So like if you're having an issue, kind of look for, a natural way to treat it cuz some of these medicines can just be a lot.
Yeah, I know First Lady and surely Dr. Gregory are both into the naturopathic. Well, Sister Regina, thank you for shedding the light on these important healthcare topics. We hope this conversation empowers our viewers to make informed decisions about the healthcare, a naturopathic, and regular conventional medicine. They can actually work together. Yes, remember, knowledge is key when it comes to your well being. Stay tuned for more insights from our resident social worker, Sister Regina Dunlap. Now, let's go back to the Hope Desk.